In terms of a situation when laser isn't a possibility, the first thing to say is that there's no question with significant twin-twin that all the studies have shown that laser is the only treatment that will help cure the problem. However, there are situations when either a laser is not available or technically a laser is not possible. And that really happens in the situation of triplets with the monochorionic set of twins. But if a laser isn't a possibility, then we really have to go back to what we used to do before laser was available. And that is really a question of trying to prolong the pregnancy as far as possible until delivery is an option, i.e. that you get past 26, 28 weeks when delivery then becomes possible because the babies have a good chance of surviving. And the way we used to do that was to literally put a needle into the womb and try and get rid of some of the excess fluid. And although that doesn't change the twin-twin, it doesn't make the twin-twin go away, it does buy time. And so we often have to do that on multiple occasions just to get the pregnancy far enough to be able to deliver. The problem with that technique is, as I said, it doesn't cure the twin-twin. It doesn't stop the twin-twin getting worse. And each time we did a procedure, there was a risk of miscarriage or preterm labour. So often these babies were born very early. And unfortunately, often because it didn't change the twin-twin, you had a possibility of one twin dying in the womb. And therefore, overall, if laser isn't available, the techniques of doing serial amnion reduction means that there is a higher rate of babies having brain injury, brain damage. Therefore now, one of the techniques that we offer when we're in a situation where there is severe twin-twin and laser isn't possible, we can offer a treatment where we can try and save one baby, but it does mean that the other baby dies in the womb. And we can do that by blocking off that baby's cord. And we only do that if the situation is so severe that that baby is going to die anyway. We have no chance of prolonging the pregnancy long enough for that baby to survive. But if that baby dies in the womb without us having done anything, there's a very high chance the other baby will die at the same time. And worse still, if that baby survives, there's a very high chance the baby survives with brain damage. So if we're in that situation, we can do a procedure called a selective feticide, where we do a procedure to block off the cord of the baby that's just about to die. That actually stops the twin-twin because there's no blood transfusion between the two and gives the other baby a chance of survival. And actually it's a very good chance of survival, and the survivors of the other twin is about 95%. So it is a technique that we use in the extreme, but it's now available and obviously more effective than just serial amnion reduction.